We also have some more information that highlights the signs of a stroke in a little bit more detail. So let's look at that. And doctor, walk me through this. The first one is sudden numbness or weakness in the face, arm, or leg, especially in one side of the body.
The brain control, one brain controls half side of your body and controls everything, control movement, control sensation, control coordination. So this is a very important sign. If half side of your face, half side of your body feels strange or weak, then you have to really be worried that a stroke might be going on.
And you obviously would know your loved ones, so if you see sudden confusion, trouble speaking, or difficulty understanding speech.
Yes. Like we mentioned before, the left side of the brain controls speech, the right side of the brain controls the way you talk. So if most patients can't speak at all or make horrendous mistakes while speaking, they're very weird and very odd, or their speech is extremely slurred. So then you can really notice there's something wrong with their speech, and that's a sign that something might be going on, some lack of blood flow might be going on in the brain.
Sudden trouble seeing in one or both eyes?
Yes, exactly, because the artery that goes to the eye comes from the artery that goes to the brain. So as soon as you block that one, then the eye gets affected as well. So they can't see, or sometimes they see double, or they see or sometimes the eyes can be skewed. So one eye goes on one side, the other side goes on the other side.
Sudden trouble walking, dizziness, loss of balance, or lack of coordination. All of this occurs because?
Yes, because the brain controls everything. So we take walking and for granted, but it's a very difficult task to achieve normally. So if some part of the brain that makes us walk don't work, you can't walk, and you're very dizzy, you're very unsteady, you're unbalanced. Some people might fall.
And sudden severe headache. We hear that a lot, doctor, with no known cause.
Right. So sudden severe headache could be two things. Could be either a sign of an ischemic stroke, but more commonly it could be a bleed, so that there's one of the artery, instead of being blocked, kind of bursts inside the brain, and there's blood gushing out of the brain, and then the first is like a big bell going on in your brain, and you have this horrendous pain. The patient described that the sudden onset of the worst headache of your life.